Have you ever wondered why some children struggle to pay attention, act without thinking, or are overly active? Well, these could be signs of attention deficit hyperactivity disorder, more commonly known as ADHD. ADHD is a neurodevelopmental disorder that affects millions of children around the world and can continue into adulthood. It's a prevalent condition, but unfortunately, it's often misunderstood. Many myths surround ADHD, and today, we're here to dispel some of these misconceptions. One common myth is that ADHD is a result of bad parenting or lack of discipline. However, this couldn't be further from the truth. ADHD is not about a child's upbringing or their environment. It's a complex disorder that involves a combination of persistent problems, such as difficulty sustaining attention, hyperactivity, and impulsive behavior. The reality is that ADHD is a biological condition. It's linked to the structure and function of the brain, and research shows that it tends to run in families. So it's not about how a child is raised, but rather how their brain is wired. Another myth is that only hyperactive children have ADHD, but this is not the case. There are actually 3 types of ADHD, predominantly inattentive, predominantly hyperactive impulsive, and a combination of the two. So a child who seems quiet and dreamy could have ADHD just as much as a child who can't sit still. Lastly, some people believe that ADHD is not a real disorder because everyone can be inattentive or hyperactive at times. But the truth is, ADHD is a medically recognized condition. It's not about occasional forgetfulness or bouts of energy, it's a chronic condition that interferes with functioning or development. So remember, ADHD is not a result of bad parenting or lack of discipline. It's not a child being lazy or defiant. It's a real, complex condition that affects both children and adults. It's about time we dispel the myths and spread understanding about this disorder. Because understanding is the first step towards acceptance and support. ADHD is a real, complex condition that affects both children and adults. But how do we recognize ADHD? What signs should we look for? To understand ADHD, it's crucial to know about its 3 main symptoms: inattention, hyperactivity, and impulsivity. While these symptoms may seem common and might resemble typical childhood behavior, their intensity, persistence, and the disruption they cause set them apart in the case of ADHD. First, let's talk about inattention. This isn't just about daydreaming during a boring lecture. Individuals with ADHD might have a hard time focusing on a single task, maintaining their attention during conversations, or even following simple instructions. They may often lose things or forget daily activities. It's like trying to tune into a radio station but constantly getting static. Next, we have hyperactivity. This goes beyond being a little extra energetic. It's a constant motor running. People with ADHD often feel restless. They might fidget, tap their feet, or have a hard time sitting still. In children, this could look like running around when it's not appropriate, or talking excessively. Imagine being a car with a jammed accelerator. Lastly, there's impulsivity. This isn't just about being spontaneous, it's about acting without thinking about the consequences. It's interrupting others, struggling with patience, making hasty decisions, or having difficulty waiting their turn. It's like going down a hill on a bike with no brakes. It's important to note that these symptoms can vary from person to person. Some might struggle more with inattention, others with hyperactivity or impulsivity. Also, these symptoms can change over time. What's consistent, though, is that these symptoms interfere with daily life, whether it's at school, work, or in personal relationships. Remember, recognizing these symptoms doesn't automatically mean someone has ADHD. It's a complex disorder that requires a comprehensive evaluation by a healthcare professional. But understanding these signs is a key part of the puzzle. These symptoms can greatly impact a person's daily activities, but recognizing them is the first step towards managing ADHD effectively. So, what causes ADHD? Is it something parents did or didn't do? This is a question that often plagues many minds, and today, we're going to shed some light on it. ADHD, or attention deficit hyperactivity disorder, is a complex condition with multiple contributing factors. Let's start with genetics. Research suggests that ADHD tends to run in families, indicating a strong genetic component. For instance, if a parent has ADHD, there's a higher chance that their child might also have the condition. But it's not just about genes, it's a complex interplay of genes and environment that shapes the development of ADHD. Next, we have brain injuries. Though not a common cause, severe brain injuries have been linked to the development of ADHD-like symptoms. This is particularly true if the injury affects the frontal lobe of the brain, which is responsible for decision-making, impulse control, and attention. Then there are environmental factors, specifically exposure to certain toxins during pregnancy. For example, maternal smoking, alcohol use, or exposure to lead during pregnancy can increase the risk of a child developing ADHD. Premature birth is another factor. Babies born prematurely or with low birth weight have been found to be at a higher risk for ADHD. However, it's important to note that most premature babies do not develop ADHD, and most people with ADHD were not born prematurely. Now let's debunk some myths. Contrary to popular belief, sugar does not cause ADHD. Neither does poor parenting nor watching too much TV. These factors might exacerbate symptoms in some individuals, but they do not cause the disorder. In conclusion, the causes of ADHD are multifaceted and complex. They range from genetics and brain injuries to environmental exposures and premature birth. But remember, none of these factors alone determine whether someone will develop ADHD. While the exact cause of ADHD remains unknown, researchers believe it is a combination of various factors. So, if you're a parent worrying that something you did or didn't do caused your child's ADHD, it's time to let go of that guilt. ADHD is not a result of your actions, it's a complex interplay of many different factors. So, how do doctors diagnose ADHD and what treatments are available? Well, the process of diagnosing ADHD is not as simple as ticking off a checklist of symptoms. It requires a comprehensive evaluation that includes medical, educational, behavioral, and psychological assessments. The goal is to rule out other conditions that may mimic ADHD symptoms, such as anxiety, depression, or certain types of learning disabilities. First off, medical evaluations are crucial to ensure that there are no physical conditions contributing to the symptoms. This may include a thorough physical examination, hearing and vision tests, and sometimes neurological assessments. Educational evaluations, on the other hand, help to understand if a child's symptoms are affecting their academic performance. A child may be assessed on various academic and cognitive skills to determine if there's a discrepancy between their potential and actual achievement. Behavioral and psychological evaluations play a pivotal role in diagnosing ADHD. They involve observing a child's behaviors in different settings and understanding their emotional and social skills. The child's parents, teachers, and even peers may be asked to provide their observations and feedback. Now let's talk about the treatment options. There's no one-size-fits-all approach when it comes to treating ADHD. It's usually a combination of medication, behavioral therapy, and lifestyle changes. Medication, particularly stimulant medications, has been found to be effective in managing ADHD symptoms for many individuals. However, it's important to remember that medication alone is not a cure. It simply helps to manage the symptoms. Behavioral therapy aims to change negative behavior patterns and improve a child's self-control and self-esteem. This can be done through individual therapy, group therapy, or family therapy. Lifestyle changes, such as a healthy diet, regular physical activity, and adequate sleep, can also play a significant role in managing ADHD symptoms. Additionally, support from family, teachers, and peers is essential in helping individuals with ADHD to thrive. Diagnosis and treatment of ADHD require a comprehensive approach, but with the right support, individuals with ADHD can lead successful and fulfilling lives. Living with ADHD can be challenging, but it doesn't define a person's potential. Navigating life with attention deficit hyperactivity disorder, or ADHD, can indeed present certain challenges. These challenges may span multiple facets of one's life, including education, work, and personal relationships. But let's not forget that every cloud has a silver lining. Individuals with ADHD often exhibit an abundance of energy and creativity, a remarkable ability to multitask, and a unique perspective that can lead to innovative solutions. What might seem like a hurdle can often transform into a high jump with the right approach and support. For parents and teachers, it's crucial to remember that children with ADHD are not being deliberately difficult. Their brains are simply wired differently, and this different wiring can sometimes lead to exceptional abilities. To foster a supportive environment, it's important to focus on the child's strengths and interests. Offering positive feedback and encouragement can boost their self-esteem and motivate them to overcome obstacles. Teaching them organizational skills like maintaining a daily schedule or breaking down tasks into manageable chunks can help them manage their symptoms. It's also beneficial to promote physical activity and healthy eating habits, as these can positively impact their overall well-being and ability to focus. In the classroom, teachers can provide additional support by giving clear, concise instructions and allowing for movement breaks. Understanding and patience go a long way in helping these children thrive. Living with ADHD is not just about managing symptoms, it's about recognizing and embracing the unique strengths and talents that come with it. It's about turning what society may perceive as a weakness into a strength, a superpower. Remember, every person is unique and every brain is unique. ADHD is just one aspect of this uniqueness. It might present challenges, but it also presents opportunities for growth, creativity, and innovation. ADHD is not a barrier to success. With understanding, support, and effective strategies, individuals with ADHD can turn their unique strengths into superpowers.